Welcome back to the Federal Executive Forum on the Federal News Network. We're talking about IT healthcare across the federal spectrum. We were just talking about specific programs, and I want to throw it over to you, Ben, and give us an example of what Red Hat is up to in regards to a specific program that you'd like to highlight.
Yeah, there's a few. I think I'm the most excited about the work we're doing at DHA right now. We're migrating legacy data systems to modern cloud-based platforms. And we're doing this in collaboration with our partners at several different system integrators using a streaming platform that is actively applying data normalization, cleansing, and then providing a bidirectional longitudinal patient record using FHIR for interoperability standards. Downstream of that platform, we have DHA partners using our AI platform technologies to produce predictive analysis at the population level. That's being proven out right now. And then the next focus is really using that same technology to craft real-time situational awareness of emergent adverse conditions like PTSD, diabetes, et cetera. That state for me is what gets me out of bed in the morning. Really excited.
Fantastic, and super important subject, super important topic, and certainly is very much a real-time situation that we're all facing. Jose, how about at HHS? On your opening, you gave us a lot of examples of different activities that are going on. See if you can narrow down to one specific program that you'd like to highlight where you guys are really going big.
I mean, HHS Protect is the largest public health surveillance system in the history of the United States. It gives us the ability to speed up clinical trials. It gives us the ability to distribute remdesivir. We're using it for that. It gives us the ability to predict outbreaks at every single level across the U.S. I can literally look at the little hospital in the rural location that I grew up with in northeastern Pennsylvania. I can see how many ventilators they have, how many beds they have. I can, how many total beds they have, how many patients have COVID-19, if there's any patients in those hospitals. One of the things that we've done with the data in HHS Protect, and you can see it if you go to protect-people.hhs.gov, we've started to dashboard and share all of the data related to the common operating picture around hospitals. We dashboard the raw data, and then we dashboard estimates so that we can extrapolate that raw data across the entire United States off of the 5,000 hospitals we have every day. And hospital reporting varies every day. That's why the number doesn't stay the same. We've also taken those raw data sets, made them downloadable on healthdata.gov, outlined the steps with which we built our predictive models, and added in policy insights that are occurring at the federal and state level across the United States. So the community of modelers and the community of researchers and the scientists of the future that are at universities can literally work with real-time data across the United States about this pandemic to hone their craft. So when Dr. Fauci and Dr. Birx and Dr. Redfield retire someday, there'll be a community of folks that can carry the baton if an event like this occurs again. We're really proud about that. We're working to partner with associations across the United States to share the data within HHS Protect. We're talking about 4 billion health data elements, federal, state, local, zip code, and county level. We need from a public health surveillance perspective, but we can make it available to associations and companies so that they can lower their fixed costs related to collecting data, related to whether it's running clinical trials or whether it's informing hospitals as to the environmental activities that are actually occurring around them. Again, it's all built off of HHS Protect. I have to say this, I'm so proud of the OCIO team at HHS. We've lowered our operating expenditures by 12%. Our budget has increased by 170% because of COVID. We've increased our customer service scores by 40%. So now 67% of our customers think we're excellent versus 27%. And we've managed to identify and drive cost avoidance of about $200 million across the portfolio. So all while building the largest public health surveillance system in the history of the United States and working, and I have to thank the Verizon folks for this. And we've dealt with some very large cyber events since March, and we built a modern MTIC to secure the perimeter of HHS, which is one of the largest internets on the face of the earth. And we were able to do that in 120 days at a 74% discount off of commercial pricing. So we have a lot going on. The biggest program is HHS Protect, but I'm really proud of the team. We've done a number of amazing things to be able to.
Incredible amount of work done under such a short amount of time with a lot of constraints. So hats off to everybody over there at HHS. All right, well, we're gonna wrap it up here, and we always like to end with talking about the future. And Ben, we're going to start with you. If you could just paint a picture, sort of look around the corner over the horizon, not too far, but what does it look like out there? What can we expect to see, 3-4 years down the road?
AI is definitely the future for healthcare, right? Most AI today is used for big data analytics. This, of course, affects population health, simulation, value-based care. That being said, I'm really excited about what happens when we use applied AI. My definition of that is AI that actually influences decision-making in real time. Think drug allergy interactions, predictions, things like sepsis, right? Getting AI predictions down to the patient level, not just for precision medicine, but to react to adverse emergent conditions as they're happening and maybe even before. We get to that state in a couple different ways. The first is by transforming the IT culture of institutions to align with like Agile and DevSecOps principles. I'm seeing more and more of that inside of the healthcare IT market, and it's really heartening to see that kind of transformation. And then secondly, the use of process automation as a bridge. If you have a care plan defined as a process and that process is actively running in state, then AI can actively influence decision nodes in the care plan. And to do that, we actually have to author those care plans. There's a wonderful initiative going on right now inside of the OMG group, which is the standards body that publishes the standards for business process notation, decision management notation, and case management for like a wide variety of industries, like finance and manufacturing and supply chain. They're now applying those same concepts to healthcare, and they're working with some of the largest healthcare institutions and federal agencies to actually produce models of care plans, and they're calling them shareable clinical care pathways.
That's fantastic. Sounds like some awesome stuff. So, Cara, give us a picture, paint a picture of the future. What does it look like in a couple of years in regards to ServiceNow? What's in the petri dish over there?
Yeah, so what ServiceNow, our plan is to help our IT organizations to really beef up their infrastructure so that if there is another pandemic or emergency situation, IT can better help their customers with providing care or information or data, to make departments a little bit more effective. Just for the VA specifically, we are working tighter with IT and HR so that those common processes or forms, we're digitizing those elements so that really the VA can get back to the mission, which is supporting the veterans and enhancing that veteran experience.
Right. Want to just enable the technology so that they can focus on the veterans. It's fantastic. Glad to hear that. John, how about at Verizon? What does it look like in the future when you fully realize 5G? What does that mean to everybody?
Yeah, it's a huge question, but I think, we like to think about it as though we have really a once in a lifetime opportunity to fuel the next industrial revolution, which is 5G. So, again, pushing technology to the edge. I mentioned earlier the launch of our machine edge compute options to really improve processing power, reduce latency, enable AI, as Ben had mentioned earlier, I think creates an unbelievable landscape of use cases that we really want to partner with industry, with government, with everyone really to try to identify. So I mentioned the work at Palo Alto earlier. I think that's just the tip of the iceberg. With 5G and the platform itself, we have an unlimited future on what we can deliver for healthcare as well as for all of our government and consumer partners. So thanks again for the opportunity, and we're looking forward to building this next industrial revolution on 5G.
Fantastic, and I think we're all looking forward to it as well. And won't hold you to the timeline there, but I'm sure it's coming very, very soon. Bill, how about over at Defense Healthcare? What's the future look like? I mean, what can we expect as a war fighter in 3 years, let's say?
Well, so let me take it up a notch as to what we should be striving for, right? We're a group of IT people here today, so we like to talk about IT. And I think that's powerful, and it helps us drive capability into the hands of the providers and into patient support. But what we really need to be striving for is, and there's a couple analogies I like to use, is IT you don't have to think about, right? Our providers and our patients, or the patients, they don't care about the IT. They care that things work and they get the experience they want. I use a theme park as an analogy for this sometimes to help clarify my thinking. So really, when you go to a theme park, you don't care about the power, how the power gets there, how the plumbing is done, how the roads get there. You care about the rides and the experience when you're in the park. And the IT people are keeping the park running. And from PEO DHMS perspective, we build the rides, which is a really cool thing, but that's what people go to the park for, is those healthcare capabilities that we provide. The other thing that I think is, it's also an analogy, I'm sorry for that, but I read something last summer, not this summer, about the guy that invented air conditioning, right? His name was Willis Carrier. I think I read it in the Post in July. And it was an interesting story because he was a printer, and he had a problem with his print plant, and he couldn't get the ink to stick to the paper because of the humidity. So he tried to figure out a way to get the humidity out of the print plant so that his print plant would work. And so he did that. He invented air conditioning to do that. He had no idea. He knew why he did it. He had no idea the impact it was going to have on the world, how we work, and frankly, even on healthcare. He knew why he did it. He didn't know where it was going to take us. We talked today a lot about what we're doing and why we're doing it. I think we're in a place now where we're doing the right things, but we're doing things that are so powerful we can't even comprehend where they're going to take us. Much like air conditioning, it did a whole lot more than allow a print plant to operate effectively.
Very good analogy, and really focus on that customer experience. Shermender, how about at the VA? What's that going to look like in 2 to 3 years?
I'm going to give a CDO-centric answer. I think we're working to further strengthen our identification and management of authoritative data at each of the moments that matter in the service member and veteran's journey, making sure that data is managed, is interoperable, and we're using it to improve operational service delivery. And then second, we have the policy frameworks in place across DoD and VA to use that data appropriately to develop insight, build evidence to improve evidence-based policymaking, and move in the direction of really understanding over the lifetime of our veterans, what's the impact of the services we provide, right? What's the cost, what's the impact, and how in the margin do we improve those outcomes around economic outcomes, health span, or dignity is measured by social connectedness.
Fantastic. Very important, and I applaud everything that you're doing over there. Jose, how about over at Health and Human Services? A lot of stuff on the deck there. What can we expect, around the corner in about 3 years or so?
Yeah, I mean, I think, and I have to agree with what Bill and John kind of couple the items they pointed out. I think that healthcare, I think the reaction to the pandemic has been an investment in data sharing. It has been an investment in ingesting and curating and making data shareable with integrity. I think across the United States, you're going to see a significant increase in investment from in the private sector to develop supervised and unsupervised machine learning capabilities off of open data sets that are going to be made publicly available. Every single morning when I woke up for the first couple months of the pandemic, I'd look out my window, working from the home office, and I'd be like, what in the heck is this guy doing at my door? My wife started ordering groceries and having them delivered. It's fundamentally changed humanity, fundamentally changed the way Americans live. It's going to, all the money that's not going to restaurants is going to be invested in technology focused on supervised and unsupervised machine learning. Government will become interoperability, data sharing with integrity, and securing those underlying data sets. I think there's a significant change that's going to occur. And don't forget one thing, and I promise to stop, Luke, because I know you're on a timeline. Healthcare is 20% of US GDP on a consumption basis. It's 55% of the United States is 55% of global healthcare GDP. Be ready for some significant changes.
That is a daunting figure there. While we have you here, why don't you give us your top priority for the year?
My number one priority for the remainder of the year is to create and provide full visibility for congressional leaders. We're working on that now. Full visibility for state level hospital associations across the United States. Automate the interactions with hospitals before the fall if possible, to make it easier to prepare for what Dr. Redfield described in his congressional testimony is the worst fall in American public health history when you combine the flu and COVID-19. So I'm focused on bringing as many capabilities to bear so that we're ready for that moment in time. We can create and provide that visibility. And I do expect a significant amount of tension. Anytime you're transparent with data, it's hard to understand. It's something new. It creates a lot of tension. It creates a lot of discussion. Preparing to deal with that. Okay,
Mark, bring us home. Paint a picture of the future. What does it look like? What can we expect?
Well, the COVID pandemic really emphasized a lot of weaknesses and obsolete practices in the healthcare system, as well as highlighted a lot of strengths and opportunities. One of the opportunities is telehealth. I know that's something that a lot of us have been proponents of, but we've really seen how great it is and how helpful it's been, and that's going to move forward in the future. There will be barriers that were up before to telehealth that will be taken down. We're going to try to reduce the clinical burdens caused by electronic health records so that doctors can focus more on their patients rather than on the quote paperwork. And another big advantage of as Jose mentioned, all the data, the healthcare data that's been coming in, is that we'll be able to do with de-identified data, a lot of data mining research. So it's not going to totally replace some of the in-person type of research, but people are going to be able to take that de-identified data and really take a cohort of folks and see how different conditions, different medications affect them, and that kind of thing. So it's really, it's a brave new world, and we really have just a lot to be optimistic about regarding that.
The theme is focus on the patient, right? And that's what we've heard throughout the show. Well, I'd like to thank today's guests for taking the time out of their busy schedules to join us for the program. I'd like to thank our sponsors for supporting us on this show. I'd like to thank the good people here at the Federal News Network that make our program so successful and enjoyable. And most of all, we'd like to thank you, the listening audience out there that tune in every month. You're listening to the Federal Executive Forum, part of the Federal News Network.